Hello everyone, my name is Ginny and I'm a volunteer at Dr. Curnew's clinic. In this video, I'll be discussing medications for type 2 diabetes in the context of sickness. So before we get started, I'd like to quickly discuss why this is an important topic. If you have type 2 diabetes and become ill, it can be easier for you to be dehydrated from vomiting, diarrhea, or even fever, and this causes stress on your kidneys and can result in acute decline in renal or kidney function. So, that means certain medications can cause problems. This video will be discussing some medications that should be paused when you're sick to prevent side effects or kidney problems. These are medications which should be started again after recovery from being sick. Before we discuss the medications, I'll quickly run over some signs and symptoms that may be experienced during sickness, specifically dehydration, hypoglycemia, and more serious conditions that may require urgent medical attention. So some signs of dehydration include thirst, unusual fatigue, dry mouth, headache or lightheadedness, dry and cool skin, irritability, confusion, and less urination. When you're sick and on medications which work to reduce blood glucose levels, you're at a higher risk of hypoglycemia or low blood sugar, and that's why it's crucial to recognize the signs so you can act accordingly. So signs and symptoms include shaking, sweating, being anxious, dizziness, hunger, faster heart rate, impaired vision, sleepiness, headache, and irritability. 3.9 millimoles per liter or less is considered hypoglycemia, but you may experience the symptoms at different blood sugar levels, such as 4 or 5, depending on the age. And this is because catecholamine activation actually decreases with age, meaning it can be harder to recognize hypoglycemia as you get older. I should also mention that people with diabetes don't necessarily experience illness more often than those without, but if it's left unmanaged, diabetes can escalate the illness and cause more serious conditions. These include diabetic ketoacidosis, acute kidney injury, and could also put you in a hyperosmolar hyperglycemic state. It can be beneficial to know or at least be aware of these signs, as these are more serious conditions which can require medical attention. You can go ahead and pause the video to take a closer look, but now I'll be moving forward into measuring blood glucose levels and also talk about the certain medications that can be temporarily stopped in the case of sickness, which must of course also be discussed with your healthcare provider. I hope it's evident from the points that I've discussed that you should check your blood glucose levels more frequently. In fact, it's recommended for you to check every couple hours in order to keep an accurate record. So here I've shown you a chart for low, normal, and high blood glucose levels given in A1C, which is what you would find in your lab results at our clinic, and a mean blood glucose given in millimoles per liter, which is what you'd most likely find in your more traditional glucometer. So note that you're not measuring your blood glucose levels in the same units at our clinic versus at home. If you need tips on how to measure your blood glucose levels, it's discussed in more depth in our first workshop video where we discuss different measuring devices and the optimal blood sugar levels. Now I'll finally be discussing the common medications to temporarily stop with dehydration from throwing up, diarrhea, sweating, etc. SAD-MANS is actually an acronym used to remember this list. It can be found online and also on Diabetes Canada, which is a great site that I recommend you visit. I should also mention that in all the lists that I'll be presenting in this video, combination medication products are actually not a part of those lists, so that's another thing to keep in mind. The S in SAD-MANS stands for sulfonylureas and other secretagogues, which work by increasing insulin release from beta cells in the pancreas. When you're sick, however, you reduce clearance of the drug by the kidneys, which increases the risk of low blood sugars or hypoglycemia, which I mentioned earlier in this video. So, hold these medications to reduce this risk. The A stands for ACE inhibitors or angiotensin converting enzyme inhibitors. They slow the activity of the enzyme ACE, which decreases the production of angiotensin II. Angiotensin II constricts blood vessels, so by inhibiting this enzyme, blood vessels enlarge or dilate, and blood pressure is thereby reduced. However, this may not be favorable in the case of illness, so your healthcare provider could advise you to hold these medications in order to decrease risk in decline of kidney functions. D stands for diuretics and direct renin inhibitor. Diuretics are commonly called water pills as they increase the amount of water and salt expelled in the urine, thereby treating high blood pressure. So, similar to ACE inhibitors, direct renin inhibitors inhibit the first and rate limiting step of the renin angiotensin aldosterone system, specifically the conversion of angiotensinogen to angiotensin 1. So, also hold these medications to decrease risk for decline in kidney function. Now, this is important. If you're on diuretics for heart failure, it's pertinent that you contact your healthcare team for detailed instructions before stopping, especially if you're on furosemide. This is because it depends on your heart failure and fluid retention status. You might already be familiar with M, which stands for metformin, the first line medication for the treatment of type 2 diabetes. And this is often held due to reduced clearance of the drug by the kidneys when you're sick, and therefore increased risk for adverse effects such as stomach upset. Some may consider restarting this at a lower dose if there is ongoing nausea or diarrhea. But again, this is a good idea to discuss with your healthcare provider. A stands for angiotensin receptor blockers. For the same reason as ACE inhibitors and direct renin inhibitors hold due to increased risk for decline in kidney function during sickness. N stands for nonsteroidal anti-inflammatory drugs. In most situations, it's recommended to continue low-dose aspirin during short-term illness, but of course discuss with your healthcare team. Otherwise, please do not take NSAIDs. They're commonly found in pain medications such as Advil and cold remedies, and it's also important to discuss with your pharmacist and healthcare provider. Note that in addition to the combination medications, over-the-counter cough, cold, and flu products which contain these medications are also not listed. I'd like to reiterate that you should ask your pharmacist if you're taking over-the-counter medications for your sickness. Many of these remedies, such as cough syrups, contain sugar, so in that case, a sugar-free product may be a better idea. The last S stands for SGLT2 inhibitors. These are a class of medications that inhibit reabsorption of glucose in the kidney and therefore lower blood sugar. They act by inhibiting sodium glucose transport protein 2, or SGLT2, so also hold these medications due to increased risk for decline in kidney function. I'd like to underscore that discussing with your healthcare team in advance is a very good idea before stopping certain diabetes medications. If you're taking insulin, you may need to increase or decrease a dose. For example, you may need to pause your mealtime short-acting insulin if you're not eating when you're sick. If your blood glucose stays higher than 14 millimoles per liter or lower than 4 millimoles per liter, you have a fever, difficulty breathing, unsure of your insulin or your medications, please contact your healthcare provider. If you start vomiting and can't keep any fluids down, or you're unable to control your blood glucose or ketone levels, please seek urgent medical advice and do not stop taking your insulin even if you're unable to eat until you seek this advice. If you do choose to discuss with your team in advance, please create a plan. This is a sample planner that can be found on Diabetes Canada, which provides a potential layout for your sick day plan. Feel free to pause the video to take a closer look. I also recommend a sick day kit, which can include a thermometer, sugar-free cough medicine or cough drops, and important phone numbers. Diet is such an important factor in everyone's health, but it's extremely important for those with diabetes or even pre-diabetes. For more information, you can watch our second Sugar Club workshop video where we discuss diet and exercise specifically for people with diabetes. Some general suggestions that are made is sticking with meat, poultry, eggs, cheese, and vegetables, and also to generally avoid milk and alternatives, which includes yogurt, fruits, fruit juice also, and grains and certain starches such as potato, rice, cereal, bread, and pasta. One of the last points I want to mention is that when you're sick, your body releases hormones to fight the infection, but These hormones may also raise blood sugar levels and simultaneously make it more difficult for insulin to lower blood sugar. If you're interested in the specific mechanisms behind how insulin works, we explain in detail in our first workshop video. This is why it's also important to prioritize calorie-free fluids when you're sick. So this includes water, clear tea or herbal tea, black coffee, and broth. You should aim to drink about 1 cup of fluid every hour and limiting your caffeine intake as it may cause you to become even more dehydrated. So that concludes my video. I hope you've learned more about changes that need to be made in case of sickness and taking those active measures to improve and maintain your health. I encourage you to watch more of our educational videos, including the videos made by more volunteers from Sugar Club, where we discuss more about what diabetes is, how to measure it, diet and exercise tips, as well as stress coping mechanisms and staying hydrated. So thank you for watching this video, and I sincerely hope that everyone is staying safe during this quarantine.